This patient presented himself to AlviArmani hair surgeon, Dr. Michaelle Ischayek, in our Beverly Hills facility. Although his hair loss was not severe, he was very anxious about the progress of his hair loss, and over-the-counter remedies were ineffective in slowing down his hair loss. Upon examination by Dr. Ischayek, the patient had good quality donor hair. His hair loss was diffuse and significant enough to justify a small hair transplant procedure of approximately 1,500 hair grafts to restore his hairline and temporal zones. On the day of his hair transplant, Dr. Ischayek reviewed the desired hairline design with the patient, shaved the scalp, and transplanted 1,443 FUE grafts, and included our enhanced PRP to encourage faster healing and hair growth. The grafts were placed to reinforce his frontal region, hairline, and temples with as much density as possible to match his existing hair density in non-balding areas. As you can see, the grafts were placed within his existing hair to fill in the thin and balding areas. At approximately 12 months after surgery, the patient forwarded photos of his new fuller hairline. This is the view from his right side with excellent hair density, and you can see the temporal closure to connect his hairline naturally at the sides. The patient was very happy with his final result, and Dr. Ischayek prescribed hair loss medication to preserve his existing hair. An expert in FUE hair restoration, Dr. Ischayek is an associate member of the International Society of Hair Restoration Surgery, International Alliance of Hair Restoration Surgeons, American Hair Loss Association, and Director of Female Hair Restoration at AlviArmani. Dr. Ischayek was named one of LA's top docs by Los Angeles Magazine and Pasadena Magazine.